All right, so welcome to our presentation as part of our module. So this is the last presentation for the health and social care sector. And today's presentation is on lead in practice in health and social care. And then we'll be presenting one by one. So we'll be having few students at the moment. So which one are we going to do? Miss Irish, I have your video. Um, or is it Miss Shamali's video? I have. Let me check first. Irish Madhwanti. Yes. Shall I play your video and we'll start the presentation from there? Is it okay? All right, so I'll be starting off the first presentation, which I have received before as a presentation video. So I'll be starting that and we'll go from there onwards.
Good evening, everyone. Welcome for the final presentation of the course. The presentation is about working with multidisciplinary teams. Here's the content. I have selected Asiri Central.
So our module is working with multidisciplinary teams, and I think I repeated the wrong one, but anyway, so we'll work on this.
Hospital to describe about multidisciplinary teams. So first, we are going to see what is Asiri Central Hospital and its services. Then what is multidisciplinary team and the key professionals of the hospital, roles and responsibilities of each professional. Then I'm going to talk about strengths and weaknesses of multidisciplinary teams and tips to create effective integrative teams, skills and techniques to build and maintain a working relationship. And finally, I'm going to talk how to motivate and lead multidisciplinary team. Let's see what is Asiri Hospital. Asiri Central Hospital is a leading brand in healthcare in Sri Lanka, counting more than 30 years of excellence in healthcare. City Health is owned by the Soflogic Group, and their people are some of the most dedicated, skilled, and experienced healthcare providers and medical experts in our country. They are adept and using many of the most cutting-edge medical equipment and technology in the industry. And let's see some services they provide. There's a heart center, cosmetic center, kidney transplant unit, and there's a radiology unit and chemotherapy ward. Physiotherapy also provided by them and elderly care service. There's a diabetic center also. Those are some of the services they provide. Let's say what is a multidisciplinary team. A multidisciplinary team is a unit of healthcare professionals who is specialized in different field and work together. Here is some key professionals in multidisciplinary teams at Asiri Central Hospital. General practitioners including specialists, nurses, and health educators and allied health professionals. Let's see who are allied health professionals: anesthesiologist assistant, audiologist, and cytotechnologist, dental surgeons, and diagnostic medical sonographers, dietitians, physician assistant, and physical therapist are some examples. Let's see the roles and responsibilities of key professionals that we have discussed. First, we are going to see about GPs, general practitioners, roles and responsibilities within the hospital. Respond to patients' medical health problems by referring to their history and carrying out diagnosis, investigations, treatment, and referral as appropriate. And discuss side effects, best condition for use, and possible interactions of medications. Contribute to the delivery of patient service with nurses, technicians, and other medical staff. Collect, record, and maintain patient information such as medical history, report examination results, and supervise and train medical students. Participate in research studies commissioned by the hospital board, and accommodate rotating shift and work flexible schedules. As well as general practitioners, there are specialists also. Neurologist and cardiologist are two of them, and in next two slide I'm going to discuss about their job role and responsibilities in multidisciplinary teams. Let's see the neurologist responsibilities and roles. Diagnose patient with a disease that affect the nervous system, develop and manage treatment plans, prescribe medication for seizures, encephalitis, meningitis, and Alzheimer's disease, among others. Assess the severity of spinal cord disorders and other deformities. Recommended alternative treatments. When needed, provide pain management treatments also. Administer various tests such as CT scans and MRI tests. Communicate with other healthcare professionals and track the patient's progress. Finally, communicate and inform patients or their family members. Let's see the roles and responsibilities of cardiologist. Diagnose and treat disorders and disease of the cardiovascular system. Perform patient exams and order or conduct diagnostic testing. Develop ongoing treatment and disease management plans. Prescribe medicine and coordinate referral as necessary. Conduct early detection screening. Maintain accurate patient records and charts. Communicate effectively with patient, physicians, and staff, and with the administrators. Let's see another major role: a hospital nurse. Hospital nurse have following roles and responsibilities. Let's see one by one: assessing, observing, and speaking to patient, recording details and symptoms of the patient, medical history, and current health, preparing patients for exams and treatments, administrating medications and treatments, then monitoring patient for side effects and reactions, creating, implementing, and evaluating patient care plans with the medical team, performing wound care such as cleaning and bandaging them, next, assisting in medical procedures as needed, operating and monitoring medical equipments, drawing blood, urine samples, and other fluids for lab work, and educating patients and family members on treatment and the care plans as well as answering their questions. Uh, then I'm going to see roles and responsibilities of allied health workers such as audiologists, dietitians, and cytotechnologists. In here, I'm going to discuss about only that three. First, we can see the role and responsibilities of audiologist. Conduct hearing or speech and language evaluation tests or examinations to patients, collect information on the nature and level of impairment using scientific instruments and automated equipment, evaluate hearing disorders to reach a diagnosis and provide treatment options, counsel and educate patient on method to improve hearing impairment, including lip reading and sign language. Next, inspect and clean the patient ear canals and fit and distribute assistive tools to meet patient goals such as hearing aids, maintain patients' records at all stages of the exam process from initial evaluation to discharge, and monitor patients' progress and release them from treatment when goals are attained. Let's see the dietitian's roles and responsibilities. Providing health advice and promoting healthy eating, advising about special diets, and making presentation on diets and writing reports, educating health professionals and public about nutrition, establishing and addressing key health needs, helping to facilitate dietary changes, working as part of a multidisciplinary team, and supervising dietary assistant and supporting the work of their healthcare professionals. Those are the roles and responsibilities of a dietitian. And finally, going to see about cytotechnologist roles and responsibilities. Cytotechnologists normally help to detect cancer and other abnormalities of cells. Let's see their job roles and responsibilities. Assisting with the collection of needle aspiration samples, preparing slides by staining samples, using a microscope to examine cellular samples, and evaluating samples while following laboratory protocols, calibrating, troubleshooting, checking, and maintaining microscope and other laboratory equipments. Finally, entering diagnostic information into computerized systems. Um, let's move to next slide. In this slide, I'm going to discuss about strength and weaknesses of multidisciplinary teams. Strengths are improve the quality of the patient's care, increase employee satisfaction, improve motivation, decrease competition, and increase diversity. Let's see the weaknesses. Lengthy decision making progress, and because each team member distribute their opinion to a problem, it can take a long time for everyone to come to a final decision. That's why it's lengthy. And the other one is increased conflicts. Let's see some tips to create effective integrative teams and promote understanding, develop a culture of learning, and communicate the clear goals and objectives, and provide necessary resources. And most of the times, team members need equipment, tools, and technology to carry out their tasks effectively. So it's important that to find out what they require and provide adequate resources in a timely manner. And also, it's crucial to make sure that availability of proper communication channels, so team members that get instant answers when necessary. And let's see the skills sorry let's see the skills and techniques required to build and maintain a multidisciplinary working relationship. Understand who does what and why. Members of a multidisciplinary team will have different qualifications, different training and methods of working. This can create different culture, which is not good for team spirit. So it is not only vital that everyone has a good understanding of their own role, but that they also should appreciate what others do. And the next point is learn from each other, then respect others' point of view, and prevent power struggles, cut the confusing jargon, finally build a community within the workplace. Those are the skills and techniques required to build and maintain a good working relationship. So let's move to final slide. How to motivate and lead multidisciplinary team. First, there should be a vision. Employees should aware of company vision in order to work towards it. And this is encourage everyone to work together to achieve better results. So have a vision is very important. Then understand the job role of a leader, understand the various roles of staff members, each and every staff member's job role, and assembling the team. Give attention to individual employees and identify what motivates them, and provide opportunities for development. Effective communication also very important in here. Effective communication with staff members and encourage teamwork. Give positive feedback. So this is the end of my presentation, and thank you very much everyone who listened to me.
All right. That was the presentation done by Ms. Shamali. It was really fine, and I find it is really interesting, and it is what we want actually. We have gone through a lot of efforts in making this kind of presentation, because I know it's not that easy to record it yourself and find information, get everything together, and about this finding information on the business and the the facts that you have to collect. So congratulations, and I'll give you the feedback. And I feel it's really good, and relating to your the question, that is really interesting and informative. So we'll move for the next one. I think we have Miss Iresha. Are you ready to do the presentation?
No, Mr. Bosel, I have done the wrong the presentation that employability skills. So I thought,
Employability skills, we did, right? We did.
yeah, last session I have missed it. So I thought
Yeah.
today's presentation is employability skills. So I
All
made
right.
for that. I'm sorry. Yeah,
Okay.
I will.
All right, sure. All right. So we'll
I
go for
will.
Miss,
No, I
yeah,
will. I will prepare another PPT.
PPTX. Okay.
Yeah, by
You can send me the PPTX and a recording or a screen recording, whatever suitable.
okay.
I think we did employability skills before, and
Yes.
it's all right. No worries. Okay. So we'll go for Miss Madhushani. You all right? You can work.
Yes.
Yeah. So you can start, and let me give the share screen option. All right. So I have given the share screen option, and see whether it works. All right, it works well. Sure. You can start now.
Mm, Good evening, all of you, and welcome to my present. I am Madhushani Ratnayaka. This is the last subject of uh, our course, and the subject of my talk is working with multidisciplinary teams. Uh, my presentation consists of the following parts. Sorry.
Yeah, you can go on. I think there is a signal problem, but still you can go on. We'll sort it out. I think there is a problem.
Hello.
Yeah,
Sir,
now it's
sorry. My connection ಗೆ ಪಡಿ ಪ್ರಶ್ನೆ
yeah. It's all right. There, yeah.
ಗೆ ಪಡಿ ಪ್ರಶ್ನೆ
Yeah, now it's okay. You can start again.
සර් මම ප්‍රසන්ටේෂන් එක සර්ට මේල් කරන්නද?
මේල් එකක් දැම්මත් කමක් නැහැ. මට එතකොට I can go one by one නේද?
මට මේ කනෙක්ෂන් එකේ ප්‍රශ්නයක් තියෙනවා මට මේ ස්ක්‍රීන් එක ෂෙයා කරන්න අමාරුයි.
Okay, if you have mail me, then I can check and download it. I think there is a problem with her connection. She will email and there will be another 1 or 2 students joining the presentation. We'll wait for them at least. Yeah, there was a problem with the student's connection, and so this is your last module related to level 5 management for health and social care. And Ms. Shamali, you have sent me your research project. I went through, is your one, right?
Yeah.
Yeah. So I went through and I'm feeling okay. You have done a good work. So I need to check a little bit more and give you the feedback, and then I'll be applying with the external verification of your
Mr. Khosla, did you check plagiarism for me?
no, I don't have the plagiarism software on this laptop. It's in my office lab, so I'll be checking by the weekend and email you the plagiarism report, because it's kind of what do you call, a space consuming software, and I have not installed in this certain laptop that I'm using for the broadcast. So I will check it by Friday or by Saturday and let you know. I can check it by Friday night and send you the report. So Madhusani, all right? Did you email me? Ah, yeah, I received it. Yes.
Yeah, yes,
Yeah,
sir.
let me download it. And yes, I have received it. Let's open it. Sometimes there is a problem with the connections. It happens to me as well. Screen. It. All right. Tell me when you want to go for the next slide. Okay. All right. You can start your presentation now.
Sir.
Yes, I have shared the screen. Can you see?
I can't see the screen
Uh,
because the
yeah, there is option.
connection is.
Okay. There is option in your mobile device. If you're using mobile device, you have to activate it or something. But can you see now? Yeah, you can go on. It's on the screen, and
Not yet, sir.
just yeah, you can go on. It's on the screen. Once you have, like, you can use it on your computer as well. Tell me when I want to move to the next slide. Okay, you can start. When it moves to the next
Okay.
slide, you can tell me.
Okay. Good evening, all of you, and welcome to my presentation. And the subject of my talk is working with multidisciplinary teams. My presentation consists of the following parts. Sir, can you move?
Yeah, I have moved to the next slide.
Can you move the next slide? I can't see the screen.
Let me share it again, then we can see whether we can see or not. All right, wait, this one. Yeah, and still you can't see, right? Yeah, you can continue. Now I am at the learning outcomes page. Um, yes, Max has joined. Okay, Madhushani, give it some time. We can start a little bit later. So we'll go with yeah, uh, we'll go with Max, and we'll give it a little bit of time. And
Okay, sir.
yeah, okay. So we'll give it a little bit of time, and we'll go with Max PPTX. Let me open it. It's multidisciplinary. Yes. Max, you good? We'll start.
Yeah,
Okay.
can you hear me properly?
Yeah, I can hear you properly.
Fine.
And this, yeah, you can see the screen, right?
Yeah, it's
Yeah, all right, you can start. When you tell me, I will move to the next slide.
okay. 1 second.
Okay. All good, right? You can see the screen?
Yes, I can. Give me a second.
Sure,
I'll
sure.
start it.
All right.
Yeah, good evening, everyone. And hi, Max. I'm going to describe a few words about the multidisciplinary team in health and social care sector. And yeah, first we'll see what is a multidisciplinary team. When it's come to a multidisciplinary, we can describe it as it's a group of health and care staff who are members of different organizations and professions like social care workers, nurses. We can include doctors as well here, and who are then work together to make decisions regarding the treatment of individual persons and services as well. And here the team are used in both health and care settings. And apart from that, I would like to add some points here, like a multidisciplinary team is composed of member from different healthcare positions with specialized skills and experts as well. And the members who collaborate together to make treatment recommendations that facilities quality patients care, and the team form one aspect of the provision of a streamlined patient's journey by developing individual treatment plans that are based on best practice as well. So here we can see that the previous learned things is also very useful for the multidisciplinary team. And next slide. Yeah, here next I got to know while I was doing my research and the searches and all, I got to know about the metaphor. First we'll see who is a metaphor. We can figure of speech that describes an object or its action in a way that isn't literally true, but help to explain an idea or make a comparisons to others. So we can call it as a metaphor. And first of all, we should consider your own organization or the job role what you are currently working. So first you should know to see where is yourself. Are you keeping it in a high position or in a low position? And next thing you have to see whether you are comfortable with that position or you want a improvement in that. Like for an example, if you are a manager, you can go for a vice president or as a director positions if you wish, and if you are capable enough for that. And the most important thing, you should be able to see others in your team as well. Where are they standing? Are they need to improve themselves? And In this case, I would like to share a few points about what shapes our beliefs and values about multidisciplinary team in a working sector, like our life history, personal and professional experiences, and the socialization process of the profession, like doctors, dentists, pharmacists, nurses, and etc. And our previous experience of team working, like whether it can be a positive or it's a negative experience, but it doesn't matter whatever it is, but we should be able to learn from it, and the personalities as well. And next slide. Yeah, here we'll be considering about how to work in a multidisciplinary team. First of all, I would like to see here it's like a families, like multidisciplinary team can work brilliantly together or be totally dysfunctional, like defined roles and boundaries, be aware of power dynamics, taking decisions. Different professionals have different views and input from service users as well. And next thing, go to next slide. Yeah, and here we can see every member should feel that they are contributing themselves in a best level to the organization, and every member should feel that others are contributing their best level for the organizations as well, and every member should do all type of tasks whatever they are getting from the managers or the team leaders, and every member should be knowing the other members of the team, whether their strengths, weakness, uh, which point they have to improve in their life or in their working processes, and all the members should be working towards a common goal in their own creative and distinct way. That should be a main thing I think I noticed here, because if, for an example, we are working on a project or something, all the members, I mean project workers, should have one set of goal. The project should get approved from the uh, vendor or someone. So if one of them, I mean if there are 5 members in a team and 4 of them are working on a one goal, I mean common goal, and if one is working on a different goal, I'm sure that it won't get approved by the vendor, or they won't be able to finish the project in a successful way. And next slide. Yeah, here we'll be focusing on a little bit about the benefits of team working in the health and social care sector. First of all, if you are talking about the patients, they should be empowers patients as active partners in care and uses time more efficiently, integrates health care for a wide range of problems and needs, and finally improves quality of the care and experience by increasing a coordination of services, especially for complex problems as well. And if you are talking about the staff members, we can talk about increased professional satisfaction in the experience of them, and enables the practitioner to learn new skills and approaches, encourage innovations, allow staff to focus on individual areas of expertise, and unleashes assets of all staff, patients, and wider community as well. And the last thing, if you are focusing on the organizations, we can say that they should be maximize resources and facilities to benefit the team and harnesses potential for more efficient delivery of care, reduce burden on acute care facilities as a result of increased preventive care, and facilities continuous quality improvement efforts like a social and financial return on investments. And last thing I would say, I would talk about the conclusion, I mean a brief description about the multidisciplinary team. Here, MDTs are like to remain an important component on health and social care as well. And I think it is very important that those who create a lead and work in them are aware both of pitfalls and opportunities of MDTs. The current integrated care developments in England and internationally should provide considerable evidence of about their deployment within different populations in all over the world. And keep learning these things will be enable us to understand when and how to multidisciplinary teams should be used in the future for upcoming care workers or nurses, anyone in the life. And yeah, that would be the end of my presentation. Thank you for the time.
Yes, well done. That was some of the it's very short and not very short, but it's really interesting that you have come across all the topics. And congratulations on your presentation. I really
you.
admire your effort because I know that you are working late night and you're coming on your break. So, okay, you can leave if you want to. And good one. And I will send the feedback on an email. So
Sure.
this is our last presentation on your module wise on the 8th module. So, and I really appreciate your effort. Thank you so much.
Yeah, welcome.
All right. Okay. So, Madhusani, shall we continue?
Okay.
Sure. Okay, I will be sharing the screen. Give me a second. Let's see how it works. All right. It's here. See if in the screen.
This presentation is not mine.
This is not your.
Yes, and not mine.
Okay, okay, okay. No problem. Let me find your one first. It's just should be. All right, got it. Sorry. So we'll display this one. Oh no, this is not the one. This is your one, but this is not the PPT file. Okay, where is it? Here it is. Found it, and all right, you can start.
Good evening, all of you. Today I'm going to talk about working with multidisciplinary teams. Next slide. My presentation consists of the following content parts. First one is what is a multidisciplinary team, who might join a multidisciplinary team, who will benefit, why are multidisciplinary teams important, advantages of multidisciplinary teams, disadvantages of multidisciplinary teams, what support and conditions do multidisciplinary teams need to fulfill their role, what is the evidence for outcomes and impact, what are the challenges of a multidisciplinary teams, what are barriers to teamwork, and find teams be successful. Next slide. Would like to look at what is a multidisciplinary team. A multidisciplinary team is a unit of healthcare professionals who specialize in different fields and work together. A multidisciplinary team may work with multiple patients, but each patient receives individualized attention from each team member. This unit collaborates on a detailed care plan to organize their services, optimize treatments, and define as an individual journey, and their condition, needs, and circumstance may change over time. The flexibility of the multidisciplinary team's care is paramount and valued. The goal of multidisciplinary care team is to provide the most comprehensive care possible at the right place and time for each patient. Next slide. Highlighting some of values that underlie an effective multidisciplinary team include respect and trust, solid implemented strategies, and transparency. In order for a multidisciplinary team to function efficiently, roles, outcomes, and modes and delivery must be clearly defined. Comprehensive policies, procedures, systems, and protocols are also necessary for the development of an effective multidisciplinary team. Next slide. Who might join a multidisciplinary team? A multidisciplinary team is first and foremost centered upon the needs of the patient and their careers. Professionals who may contribute to team include general practitioners, practice and community health nurses, allied health professionals, health educators, and specialists. Next slide. Who will benefit when multidisciplinary team work effectively? Both patients and practitioners benefit. Benefit include increased satisfaction, improved time management, efficient use of resources, and improved health outcomes. Next slide. Why are multidisciplinary teams important? Multidisciplinary teams are important because they allow patients to receive comprehensive, individualized care from efforts in specific disciplines. For example, someone with diabetes may have multiple symptoms and complications to address. Instead of seeing a general practitioner for the varying issues, the patient can work with the multidisciplinary team to receive the most comprehensive care. This person might work with the stroke or heart disease or eye conditions. The other collaborations of these specialists can help patients receive the service and treatment they need. These professions can meet patients' complex need without neglecting or ignoring issues that may accelerate existing conditions. Next slide. Next. Okay. Advantages of multidisciplinary teams. First one is it gives a patient access to an entire team of experts. When a multidisciplinary team is formed, it allows a patient to receive collaborative supports from a wide range of experts. Second, it improves service coordination. It expedites the referral process. It creates new avenues for service implementation. It allows patients to create goals for themselves. Next slide. These are the disadvantages of multidisciplinary teams. There is always a time pressure involved in providing services. Different team members come from unique backgrounds. It requires frequent collaboration to be effective. Uh, it, requ- it is dependent upon available resources. Uh, Incomplete decisions happen without complete information. And last one is if it wasn't documented, then it didn't happen. Next slide. What support and conditions do multidisciplinary teams need to fulfill their role? Trusting relationships within the team, a shared vision of integrated care and clear goals, strong system and team leadership accompanied by consistent working practices and protocols, good access to shared resources across partner organizations, a broad range of community-based service from which to provide proactive care management, opportunities for informal communication and reflective team learning, responsibility for individual service users, shared access to the care records of service users, specific training and professional development, especially joint training within the team, and a good mix of professional backgrounds and boundary spanning roles and involvement of service users or their careers in care planning and decision making. Okay, let's talk about what is the evidence for outcomes and impact. Better treatment planning and compliance. More services provided at home or close to home is utilization, greater self-management and better preventative care to stay well, improved service user experience, people's engagement and activation through social prescribing and shared decision making, gather continuity of care across different care settings. And next slide. Okay, what are the challenges of a multidisciplinary team? Maintaining a productive and friendly team can become difficult. Issues such as uncertainty of the team's position in the overall services, caseload, poor coordination between team members, and uneven work distribution may cause disruption. And next slide. Okay, what are the barriers to teamwork? Ineffective leadership, goal confusion, communication gaps, lack of trust, team size, accountability issues, poor conflict resolution skills, lack of incentives. Next slide. How can multidisciplinary teams be successful? Establish trust and respect between team members. Establish systems and protocols for governance and communication. Encourage advocacy for addressing all elements of patient care. Prioritize goal established by the team. Thank you.
Okay, that was
This is the end
really
of my presentation. Thank
all right. All right. So I know that there is a problem with the connection, and Anyway, you with all the challenges, you did well at your presentation. I was listening to it all around, and I might have to say it doesn't matter with the connection. You are doing well, and you have improved a lot throughout this program. And congratulations on your presentation. I will give you the feedback on an email. So right now it's the farewell time, and I don't find students joining for the presentation yet. So I will end the recording, and for the further questions, I will continue the session. So this is the end of the presentation, and I will be sharing the recording once it is being processed.